Hello, I'm Elva Theodorsson of Linköping University in Sweden and wish to discuss with you what is special for measurements in laboratory medicine. Physical metrology, as we know it, has its roots in the French Revolution, which emphasized the standardization of the unit for length and for mass. Until recently, objects in platinum represented these units as objects that could be seen with the eye and felt with the hand. In contrast, measurements in laboratory medicine are commonly about measuring the concentration of molecules that are present in very low concentrations amongst a multitude of other molecules, many of which are present in much higher concentrations. The two primary tasks are therefore to visualize the presence and the concentration of the molecules of interest using physical methods, commonly the absorbance of light at specific wavelengths, and using selective chemical reactions to make sure that in practice only the molecules of interest are being measured. In analytical chemistry, the client is obviously interested in the concentration of certain molecules. However, these concentrations are usually compared to concentration limits determined in laws and regulations. In laboratory medicine, the fundamental question is instead whether a patient is healthy, at risk, or sick, or whether he or she has been improved by treatment or not. Both the chemical and physical methods used in laboratory medicine are subject to influences by other molecules in the sample and in the reference material than the molecules of interest. These influences by all these molecules are called matrix effects. Even though the chemical and physical method used both cater for selectivity, they are both subject to influence factors that can lead to falsely high or low concentrations of the measurement, that is, of the measurement resulted reported. Ultimately, it is thus up to the healthcare professionals to use the measurement results together with the clinical information he or she has about the patient to make clinically relevant decisions. The knowledge and skills of the healthcare personnel that order the test are of crucial importance for the proper interpretation of test results. They play an important role in creating decision limits and in creating reference intervals. They also contain several important factors that influence the interpretation of the measurement results in a clinical context, including age, the sex of the patient, the effect of treatment, the biological variation in the patient, the menstrual cycle, the use of pharmaceuticals, drugs, tobacco, alcohol, and so on and so forth. The proper use of measurements in laboratory medicine is therefore always a combination of the competence of the laboratory and of the competence of the healthcare personnel. An example of this is the use of measurement systems in different clinical contexts. In this case, that is in the case of screening, the measurement system is used for screening for disease. Then the number of diseased among all tested is low. This usually means that the risk of false positive or false negative results is higher compared to a situation where the prevalence of disease is high, as here, amongst the persons tested. healthcare personnel that select patients on the basis of anamnesis, symptoms and signs, and maybe of other diagnostic measures, they increase the prevalence and thereby increase very substantially the positive and negative predictive values of the test. Sound methodological principles and practices are obviously absolutely crucial for optimal diagnosis and for optimal treatment results. In this example, a positive bias has occurred in the measurement system used. There are +5 units, and this means that healthy persons are diagnosed as sick, and comparison of previous results to the current results may result in lack of treatment or in unmotivated treatments. Thank you very much for your attention.